And our next session hits on the challenge that has largely defined all of our lives for almost 2 years now, the COVID-19 pandemic. Our next speakers will tell us how both Ukraine and Israel are fighting the pandemic and how their collaboration in the broader field of health is changing lives. First up is Dr. Viktor Liashko. He has served as Ukraine's Minister of Health since May 2021, helping guide the country through the massive challenges of dealing with the pandemic. He has a Master's of Public Administration in the field of healthcare and previously led the State Sanitary and Epidemiological Service of Ukraine. He joins us on his experiences from the front line of this global story.
Шановні гості та учасники форуму, користуючись нагодою, хочу подякувати уряду держави Ізраїль за підтримку у боротьбі з пандемією COVID-19 та сприянню нашим спільним ініціативам щодо розвитку медичної системи України. Всіх цікавить відповідь на одне і те ж запитання – коли ця пандемія закінчиться? Неприємна новина в тому, що COVID-19 може не зникнути ніколи. Хороша новина – ми можемо повернутися до нормального життя із циркуляцією цього вірусу поміж нами. Все більше науковців натякають, що ковід стане ендемічною хворобою. А це потребуватиме від нас нових протиепідемічних заходів, які відрізняються від тих, що були на початку епідемії. Хвилі обмежень і локдаунів у світі після того, як було оголошено про появу SARS-CoV-2, мали зрозумілу мету – запобігти поширенню коронавірусної хвороби, зменшити кількість інфікованих та врятувати медичні системи від колапсу. Сьогодні потрібно визнати – запобігти поширенню коронавірусу по світу не вдалося. SARS-CoV-2 не тільки живе в людській популяції на всіх континентах, він ще й підлаштовується до умов перебування за допомогою мутацій. Але позитивним є те, що всі наші реагування на всі ці мутації складаються не лише з гасіння пожеж. За 1,5 року перебування в постійній турбулентності і в світі, і в Україні вже зроблено ряд інвестицій в систему охорони здоров'я, які сьогодні вже дозволяють підвищити готовність для наступних глобальних та місцевих викликів. Пандемія COVID-19 стала каталізатором важливих змін в системах охорони здоров'я, пришвидшила раніше заплановані ініціативи та реформи, спрямовані на досягнення цілей універсального доступу до послуг охорони здоров'я. Маю надію, що уроки, які людство винесе по завершенню пандемії, стануть рушійною силою для подальшого розвитку та здійснення реформ у сфері охорони здоров'я. Незважаючи на непростий пандемічний рік, ми продовжуємо в Україні медичну реформу та працюємо над стратегією розвитку системи охорони здоров'я 2030, яка буде представлена Міністерством охорони здоров'я у грудні цього року. Враховуючи передовий досвід у вакцинації, зокрема і Ізраїлю, Україні вдалося пройти пік захворюваності самої тяжкої хвилі COVID-19 без введення загальнонаціонального локдауну. Сьогодні у нас триває кампанія з вакцинації, і ми впевнено вийшли на середньоєвропейські рівні вакцинації та продовжуємо нарощувати її темпи. Україна наближається до цілей Всесвітньої організації охорони здоров'я з вакцинації 40% дорослого населення до кінця 2021 року. Незважаючи на те, що епідемічна ситуація у світі не дозволяє нам повернутися у доковідні часи, Україна зробила максимально безпечним та зручним цьогорічне святкування Рош-га-Шана в Умані, розуміючи важливість збереження культурних надбань і традицій. Сьогодні, як ніколи, важлива консолідація та підтримка світової спільноти у боротьбі з пандемією. Соціальна відповідальність має стати гарантією безперешкодного доступу до вакцинації в усьому світі. Спільними зусиллями можна подолати будь-які виклики. Дякую за увагу.
Thank you so much to Minister Liashko. And really playing a similar role right here in Israel is Professor Salman Zarka, a physician and the Israeli Health Ministry's chief COVID-19 officer. Professor Zarka, thanks so much for being with us.
Thank you. Hi.
So you are carrying an enormous responsibility shared by counterparts around the world, really helping to set the country's policies for handling this pandemic. First off, how concerned are you about the Omicron variant? I mean, there is a lot of misinformation out there. There's a lot of uncertainty at this point in time. What's your take?
Really, after about 2 years with the pandemic, I can say it very clear that a lot of our mission are dealing with uncertainty. Unfortunately, the virus does not behave according to our plans, our orders, and in many cases, we have to react before it become late. New variant arose at the South Africa, and we have to wait our different steps that we could use to deal with this new uncertainty. At the moment, we still lack concrete and systematic information regarding the characteristics of the Omicron variant. We need more data about three issues. The first one, it's its infectivity and how easily it spreads. It seems that this issue, this variant is more infective than the Delta, and we are worried about that. The second issue is to understand its violence and the severity of the illness it causes. We still need more data about that. And the third issue, it's really special attention, is to understand the immune evasion that still remains unclear, although it seems that people who are vaccinated and protected will get a mild illness, but we need more data about this issue. We hope that from South Africa, maybe from the United Kingdom, we will have more data. It seems that we need another 1 week till 2 weeks to be more sure about this new variant. We are in Israel have already 21 cases, many of which are fully vaccinated, include a booster shot, and all of them have mild symptoms. And we hope that we can have these answers, this important data, in order to calculate our steps for the next 2 weeks.
Professor Zarka, as you mentioned, you're heading into, facing this new variant after quite a bit of experience, really, with different approaches, with lockdowns, with opening up, with vaccines, of course. Has your perspective, how has it changed over the course of the last year and a half in terms of how to deal with a moment like this when we're faced with a new variant?
I think all of us have to understand that the emergence of Omicron, all of us have to realize that we have to live with the corona and to have to find our new life, understanding that the corona is here and it will still here. And we need to think about other facilities, other way of life in order to continue our life. During the 2 years, we have witnessed many new variants. During the pandemic, many of them did not have any public health impact, while several successful variants, all of us are familiar with Alpha, Beta, today Delta, and Omicron. And we have to understand that this virus and these variants are part of our life, and we have to be ready for such a new one that will cause more illness at our country and all over the world. 3 weeks ago, hoping we are getting out of our fourth wave with the Delta, we had a big drill. We called it Omega, was the name of the new virus that invaded our country. And the drill made some issues very clear to all of the staff dealing with the policy regarding the pandemic. We understand that when there is a new threat, it is better to act strongly and then release than wait and see. I think this is what we tried to do here in Israel in the last 10 days, to close borders, to be more in high alert, and to have more data in order to decide what to release and how to release. I think, again, after the 3 waves at Israel, the best weapon in order to deal with the pandemic, in order to deal with COVID-19, is and is still the vaccine. People need to be protected against this virus. The vaccine does not help protect us 100%, and we need another facilities such as like mask to be aware about the risk and the community with the environment, and to try everybody to minimize his risk by avoiding crowded area and take some meters away from others. I believe that this policy will still relevant, whereas the current vaccine is good enough for the Omicron, or we need to update the dose or the vaccine. I believe that in any scenario, we have to understand that COVID-19 is here, it is still here, and we have to think about our new style of life in order to continue to achieve our goals, our missions, and our dreams.
Right.
There is no time to waste waiting till COVID-19 leaves our world, and this is our new world, and we can do well, although the virus is here.
Adjusting to a new reality. If anyone is under the illusion that this is behind us, I think you've made clear that that is just an illusion. It is a new way of life. Let me just ask you one final question. You've given us some very important takeaways about how to deal with new variants in this pandemic. The pandemic has also, as you know, I'm sure better than anyone, put health systems under pressure that they have never experienced before. Do you have any sort of takeaways, bigger picture, that you would recommend going forward, lessons learned, things that might need to be implemented in the future?
I think we have many lessons learned from the experience with the pandemic at Israel and all over the world. Maybe the most important one is that our health system have to be flexible and with the ability for scalability in order to cope with these waves of disease and changing the magnitude according to the situation. I think such flexibility and scalability are needed across all the areas of the health system, including physical infrastructure, such like ICU beds, medical equipment, and the most important is the people, is the healthcare personnel. The pandemic demonstrated really the importance of having a strong community-based component in the health system. In addition to the acute care hospitals, the majority of the patient will be managed in primary care, and I think we have to strengthen the community care in order to relieve pressure on the hospital system by reducing the referrals and preventing the hospital admissions. Somehow to do it with having more vaccination rate at the community. I think also the pandemic highlighted the existing health inequalities in many countries, especially in vulnerable population that reduce access to healthcare. Maybe we have to deal with 1 month of emergency. It's differ from already 2 years that we need our facilities in order to deal with Corona, with the COVID-19. But other patients, non-COVID patients, need many facilities and they need their care, especially with cases, with severe cases that need surgery, that need chemical treatment, and so on. I'm not familiar with the Ukraine health system, but I really believe that our lessons and their lessons is important for all of us and for many countries all over the world. You know, for many years, I dealt with security emergency scenarios regarding our borders at the north of Israel. as the director of Ziv Medical Center, and I really believe that there is big similarity also with secure missions, but dealing with pandemia for this long time, we never had such a secure mission at Israel. So I believe all of us can share knowledge, can share experience, and can do together in order to make it better and to try to have our life back with the COVID-19, but to continue doing what we want to do.
Absolutely. Well, this is exactly the forum to do that. And really, as you say, if at least lessons can be learned and changes made as a result of this pandemic, then that's one positive thing to come out of this massive change to all of our lives over the last couple of years. Professor Salman Zarka, thanks so much for being with us and sharing all that knowledge you've picked up over this last period.
Thank you very much. Wishing you Hanukkah Sameach and Happy New Year.